Hello, residents of Freedom Village. This is John Bruner, your Executive Director. Today is Friday, October 2nd. I want to share with you some news. This is a letter I'm going to read to you that I will be putting out over the intercom system today, Friday. This will be recorded, is being recorded today, Friday, October 2nd, and being played throughout the weekend, but important news about COVID cases here at Freedom Village I want to share with you. So I'm going to read you this letter now. Dear residents, this morning we received news of 2 independent living residents, a couple that lives together, who have tested positive for COVID-19. The residents reported to us today that one of the residents felt the onset of symptoms on Tuesday, September 22nd, and the other resident felt the onset of symptoms on Friday, September 25th. Both were tested on Tuesday, September 29th, and they received the results today. Both residents reported that they have been self-quarantined since the end of day on Wednesday, September 23rd. Today, our wellness nurse spoke with these residents, and they both report that they have mild flu-like symptoms. The health department's guidance is that we are to contact trace individuals that came into close, high-risk contact with these residents in the period beginning 48 hours before their symptom onset. We have identified 2 other Freedom Village couples that they came into close contact with, and we are in the process of contacting them and advising them to quarantine. Today's news is in addition to the news I shared in my memo yesterday of another positive COVID-19 test result from one of our independent living residents. I spoke with this resident by phone yesterday, and they told me that they have mild improving symptoms. The resident is quarantined in their condo. This resident reported an onset of symptoms on Monday, September 28th. The test was administered on Tuesday, September 29th, and the resident reported no interactions with other residents since last Friday, September 25th. So we've had 4 positive COVID-19 cases in independent living within the last week. Each of these 4 residents remain in their condo, and a nurse is making wellness calls 2 times per day, each day, to check on each resident's symptoms. This afternoon, we met with our COVID-19 task force, including our medical director, Dr. Andrew Ulichny. We reviewed the current cases of COVID-19 and the restrictions that we've put into place here in independent living to mitigate any further spreading of the infections. The task force agreed that the steps taken and restrictions reintroduced are prudent and in line with all the public health officials' current guidance. So the following independent living activities are currently suspended: transportation for all but critical medical appointments, visitation from family or friends indoors or outdoors, resident-to-resident condo visitation, cross-campus visitation indoors or outdoors with residents of the gardens, memory care, or skilled nursing, use of all public areas for meetings, gatherings, meals, or other activities. This includes the beauty salon, atrium, dining room, hunt club, card room, billiards room, bocce court, and auditorium. The suspension of housekeeping and housekeeping in condo cleanings, as well as dining room service. These restrictions will continue for 14 days from the last positive test for COVID-19, and with no further positive cases, at which time we can re-enter the phases of reopening. In order to provide our residents with a safe means to continue with exercise that is vital to our residents' physical and emotional health, today we've placed sign-ups outside the pool and the fitness center for 1 resident at a time to use those spaces. 1 resident could also mean a couple that live together. Face coverings are required while exercising in the fitness center, but not required while in the pool. We have implemented enhanced sanitation in both of these areas in between usage. I thank you for all your continued use of face coverings, hand washing, and social distancing. I want to remind residents that if you use our benches outside and you sit within 6 feet of one another, that you must wear your face mask. Thank you for your compliance with this and all of our safety protocols. Here's a note to our staff in this memo. For our staff, during this heightened level of restrictions in independent living, I ask you to avoid crossing between levels of care that you are not assigned to work. Please see your manager if you need clarification on this. We want to mitigate the risk of infections crossing across our campus. In addition, we are limiting the number of staff using break rooms at any time for breaks or meals to further minimize the risk of passing infections. So this is a challenging time for our community, but I know that we all understand the gravity of the situation, the importance of following these protocols and getting through this 14-day period as a community. So I want to thank you all, and I will talk with you next week. Thank you.